The lack of access to menstrual hygiene products, safe sanitation facilities, and accurate menstrual health education remains a significant yet under-discussed challenge in Nigeria. Affecting millions of girls and women across urban and rural communities, the issue has far-reaching implications for education, public health, economic participation, and human dignity. Although awareness has increased in recent years, the scale of the problem reveals persistent structural and socio-economic gaps that require urgent attention. Globally, an estimated 500 million women and girls lack access to adequate menstrual products and facilities, according to the United Nations Women. In Nigeria, advocacy groups and national reports estimate that more than 37 million girls and women experience period poverty. Rising inflation and economic hardship have compounded the crisis, with recent reports indicating that sanitary pads can consume up to 11% of a low-income household's monthly earnings. For many families already struggling to afford food, transport, and school supplies, menstrual products become an unaffordable necessity rather than a guaranteed right. The educational impact is particularly alarming. Studies cited by development partners show that more than 1 in 4 Nigerian schoolgirls miss classes during their menstrual cycle due to lack of products or inadequate water and sanitation facilities in schools. In rural communities, where access to clean water and private toilets is limited, absenteeism rates are even higher. Over time, repeated absences can lower academic performance, increase dropout rates, and reduce future employment opportunities. Beyond missed classes, many girls report feelings of shame and anxiety, reinforcing social stigma around menstruation and limiting participation in classroom and extracurricular activities. Health consequences further deepen the crisis. Girls who cannot afford sanitary pads often resort to improvised alternatives such as old clothes, tissue paper, or other unsafe materials, increasing the risks of infection and reproductive health complications. Poor menstrual hygiene management has been linked to discomfort, illness, and in some reported cases, heightened vulnerability to exploitation. Cultural taboos surrounding menstruation continue to prevent open conversations, leaving many young girls uninformed about their own reproductive health. Historically, menstrual health has received limited policy attention in Nigeria. However, momentum has grown in recent years. In 2024, the federal government removed value-added tax (VAT) on sanitary products in a bid to reduce retail costs. Nigeria also convened a national summit on menstrual health and hygiene management, signaling greater institutional recognition of the issue. Despite these efforts, stakeholders argue that tax waivers alone cannot guarantee universal access, particularly for girls in remote or conflict-affected areas. Comprehensive strategies that integrate product access, menstrual education, and improved water and sanitation infrastructure remain essential. Community-driven initiatives are increasingly filling the gap. Non-governmental organizations across states such as Lagos, Oyo, and the Federal Capital Territory have distributed free or subsidized sanitary pads, introduced reusable pad programs, and conducted menstrual health workshops in schools. These grassroots interventions have reportedly reduced absenteeism and improved confidence among beneficiaries. Private sector organizations have also joined advocacy campaigns incorporating menstrual products donations into corporate social responsibility programs. As Nigeria confronts this silent epidemic, experts agreed that menstrual health must be treated not merely as a woman's issue, but as a development priority. Addressing period poverty demands coordinated action from governments, civil society, the private sector, and communities. Ensuring that no girl misses school and no woman loses dignity because of menstruation is central to achieving gender equality, improving public health outcomes, and strengthening the nation's human capital. This is Messi Kilani, reporting for Ask Nigeria.